Okay. Welcome to our webinar. I'm here with Dr. Hal Danzer and myself, Dr. Susan Maxwell, and we're going to be speaking today about a holistic approach to egg and sperm health. Next slide. I'm Dr. Susan Maxwell. I'm board certified in both obstetrics and gynecology and reproductive endocrinology and infertility. I completed my residency in OBGYN and my fellowship in reproductive endocrinology and infertility at New York University School of Medicine. I then practiced in New York City for 5 years before joining SCRC in the Santa Barbara location. Next slide. And I'm accompanied today by Dr. Hal Danzer, who is the co-founder and partner of Southern California Reproductive Center. Dr. Danzer has devoted his career to helping many patients fulfill their dreams of becoming parents. He's also board certified, and he served on UCLA's Reproductive Endocrinology and Infertility Fellowship Program. He's an assistant clinical professor in the Department of Obstetrics and Gynecology at the David Geffen School of Medicine, and a reproductive endocrinologist at Cedars-Sinai Medical Center, an attending physician in its Department of Obstetrics and Gynecology. Okay, next slide. At SCRC, we have more than 25 years of experience in the field. We have 2 state-of-the-art embryology labs. One is located in Beverly Hills, the other in Santa Barbara. Our centers both have on-site surgery centers where we do our procedures, and our procedures location is attached to our embryology lab. We have locations with our satellites in Beverly Hills, Pasadena, Santa Barbara, and Ventura. Next slide. So what sets apart our lab, our art lab, is that we have experienced and certified laboratory directors that are really top in their field. We do double witnessing verification of all of our gametes to make sure that patients are receiving the correct samples. We perform vitrification, which is a flash freezing method of sperm, eggs, and embryos. And this has really improved pregnancy outcomes from freezing over the years. We also perform a large number of blastocyst biopsies in order to perform genetic testing on embryos. So this is called PGT-A or PGT-M testing. And we're able to look at all 24 chromosomes within the embryo to screen if they are normal. We can perform sex selection, or we can look for single gene disorders if those are identified in the parents beforehand. We also utilize a technology called the embryoscope in both our laboratories, and this is time-lapse video analysis of the embryos as they develop. So we're able to use this data along with our genetic testing to really select the embryos that have the best chance of making a healthy pregnancy. Next slide. Today, we will be talking about age-related decline in fertility, the different testing approaches that we use to evaluate the patient, and then how taking a holistic approach to your care can really improve pregnancy outcomes and optimize your fertility. At the conclusion of our presentation, we'll be performing a question and answer session. Next slide. So first we'll discuss age-related decline in fertility. And what this means is that women are born with all of the eggs they will ever have. And then throughout their lifetime, these eggs undergo attrition, which means cell death, and the egg numbers go down. And then when a woman goes into menopause, most of the eggs in the ovaries have been depleted. most of the loss of the eggs actually happens before puberty. And then with each menstrual cycle, women will lose somewhere between 400 and 500 eggs. Next slide. And what we found over the years is that as women get older, the chance of conception declines each month. The chance of conception per month declines with age. And the reason for this is that the percentage of genetically normal or healthy eggs that a woman produces or ovulates decreases with age. So when we do testing of embryos, in women who are under 35 years old, approximately 50% of the embryos that we test are genetically normal. At 38, it's about a third, and at 40, it's about 20%, and then it declines to 10% or less. Next slide. The definition of fertility in a woman who's under 35 years old is somebody who's been trying to conceive for at least a year. And in women who are older than 35, we define infertility as trying to conceive for 6 months. The reason for this, again, is that egg quality is declining over the age of 35, and so you do want to seek help if you're having a hard time conceiving. Next slide. So patient testing, when we see a new patient, we do a detailed medical history and we do a physical exam and diagnostic testing. Some of the tests that we do is ovarian reserve testing, and there are a few different tests that we do to assess how many eggs are in the ovaries. One test is a blood test called an AMH, an anti-Müllerian hormone, and this is a marker of the total number of eggs in the ovaries. So a normal AMH value is 1 or higher. Other blood work we do is an FSH level at the beginning of the menstrual cycle, and elevated FSH is associated with declining egg counts. And finally, we do a pelvic ultrasound and we look at the uterus and ovaries. And from the ovaries, we calculate antral follicle count, which is the number of resting eggs. And so here in this picture, you can see the little black circles, which are the follicles on the eggs. And we get a sense of whether the ovarian reserve is normal or not based on the ultrasound. Next slide. Other tests that we do, we can do to assess the uterus. This is called a hysterosonogram or a saline infusion sonogram. And this is a test where we put a catheter in the uterus and we put some fluid inside. And the fluid is black here in the image. And when we distend the cavity with fluid, we're able to see if there's any abnormal structures inside, like polyps, fibroids, scar tissue, or any retained tissue from prior miscarriages. Next slide. On the male side, we typically perform a semen analysis. And the important aspects of the semen analysis are the volume of the sample, the concentration of the sperm, how many moving sperm there are, and then we look at the shape of the sperm. Okay. Next slide. So in general, at Southern California Reproductive Center, we believe in a holistic approach to treating patients with infertility. And this includes incorporating other treatment modalities in addition to our medications that we're giving, just to improve pregnancy outcomes. So this can include diet, exercise, and focusing on your nutrition, alternative methods such as acupuncture or mindfulness techniques. Next slide. So, what are the benefits of nutrition? Well, vitamins and nutrients are linked to positive effects on fertility. There's not a single diet that is better than other diets for fertility and your health, but you do want to make sure you're getting plenty of lean proteins. And diets that are rich in whole foods. So you want to avoid processed foods, which have very little nutritional value. So, for instance, the Mediterranean diet has a lot of plant-based foods, such as whole grains, vegetables, legumes, fruits, nuts, and seeds. Folic acid is a really important nutrient for early pregnancy, and this can be found in legumes, asparagus, or dark leafy greens. Vitamin B12 is important. This is found in organ meats, and omega-3 fatty acids, which are found in fish, and flax seeds, walnuts. Next slide. A lot of our patients utilize acupuncture in conjunction to our fertility treatments. And acupuncture can improve sleep, reduce stress, and improve blood flow throughout the body as well as to the ovaries. And when used as a treatment for infertility, it can help boost blood flow to reproductive organs, balance hormones, and relieve stress. Next slide. The common reasons why patients receive acupuncture is, again, to increase blood flow to the developing follicles, circulate blood to prepare the uterine lining for transfer. So there's some thought that if you're improving blood flow to the uterus, that will help the lining develop. It can also be used to regulate the menstrual cycle and decrease menstrual cramps or pain with menses, and decrease some hormonal symptoms like headaches or symptoms during pregnancy. Next slide. Managing stress throughout the process is very important, and patients who are undergoing fertility treatments do suffer from increased stress and anxiety. So while stress does not directly cause infertility, I find that in patients who have multiple stress factors happening at the same time, whether that's physical stress, mental stress, not getting enough sleep, this can compromise their outcomes. It's hard to measure, but we frequently have patients who take some time, reduce their stress, go on vacation, and then the next month they get pregnant. So there is some correlation there between stress and fertility rates. Prolonged stress also produces hormones such as cortisol, which may interfere with normal ovulation. Things like meditation or getting moderate amount of exercise may help, but I tell patients that you also don't want to overdo it and do too much exercise because that can increase the stress on your body. Next slide. Practicing mindfulness is also a great way to reduce your stress. Take a break from social media or things that are causing you to feel stress or anxiety. And it's okay to say no to events or cut back on the things that you're doing in order to manage your stress. Sharing feelings, talking with other people, and having a good support system can help. And take care of yourself and do activities that make you feel good. And then trying different mindfulness practices such as meditation can be beneficial. Next slide. And along with this, it's important to be aware about mental health during IVF. 56% of women and 32% of men reported significant symptoms of depression while going through infertility treatments. And 76% of women and 61% of men have symptoms of anxiety while going through fertility treatments. So patients sometimes benefit from therapy or counseling sessions to really talk through these emotions and help with their stress and anxiety. Next slide. Okay, now Dr. Danzer is going to continue.
Thank you, Dr. Maxwell. That was an excellent presentation. You're always so clear, and
Thank you.
that's important. Thank you. I was talking with Dr. Maxwell at the beginning of the, just before we started about why people always ask, how do you get started in reproductive endocrinology and fertility? And as mentioned, my grandmother in rural Montana, early 1900s, was a midwife. And you can kind of imagine what they had for fertility treatments back in Montana. Of course, everybody got pregnant when they were 18 or 20, and they didn't have that age effect on the ovary, which is so much of a problem today with the genetics of the egg. Um, I had the opportunity in college to have a pre-med advisor who was just a recent graduate from UC Berkeley, was an endocrinologist, and did research projects on the ovary and the adrenal gland in the laboratory. And then when I got to medical school, kind of walked in, and over the front of one of the science buildings was Edwin Doisy Memorial Building. And Dr. Doisy was an endocrinologist, or maybe one of the first. He got the Nobel Prize for characterizing the structure of estrogen, which is really a very basic molecule. So I began to realize that maybe endocrinology was my path. And then after I finished my residency in OBGYN, a new graduate from the NIH, National Institutes of Health, was beginning to work just very basic studies on measuring pregnancy hormone, one of the original techniques to actually measure pregnancy hormone through pregnancy. And he said, well, I need a fellow to help do some of this research. And there I was. So, but I've had the opportunity to work with, thousands of couples over the past 20 some years, and helping them build a family. It's been rewarding in so many ways. It's a bit of a process of taking couples through fertility diagnosis and then treatment. But luckily today, over 2/3 of couples or individuals are able to become pregnant, have their family. So we go to the next slide. So how do you optimize your fertility? The do's and the don'ts. And we talk about maintaining an ideal weight, and everybody has to look at their BMI. We're all surprised that we think we're doing pretty well, but we're on the edge of what's normal. And I think that's important to have a goal of what you think is best for you. Going into fertility treatment and certainly preparing to be pregnant, you want to have your body at its best weight and its best physical shape. You want to carry a pregnancy without complications. And we know that healthy pregnancies are best when your weight is best. So looking at your BMI and getting a plan to get it where you need to be. We have some polycystic ovary patients that are struggling with their weight, and their BMI is over 30, which is kind of a signal that there can be problems with pregnancy and getting pregnant. So it's important that you understand what that goal is. There are a lot of women starting on Ozempic and those other products to help them lose weight before they start the fertility journey. And that's a good conversation to have with your primary doctor about what is your ideal weight and how do you get there, and have a goal. So the next is reducing stress, and Dr. Maxwell talked about that. I think it's a plan that everyone has to have, and it's unique to every individual. How you deal with the stress in your life. Stress not going to go away ever, but it's a unique stress that individuals or couples have going through fertility treatment. Is it going to work? Am I going to have a family? And that's a huge stress of the unknown. One of the best stress reducers and things that improve your physiology and help with your weight is a daily walk. There's a lot of studies that are out recently looking at 30 to 40 minutes of walking, getting outside the house, getting outside the stress, getting into your mind. The benefits to not only your physiology, but your neurochemistry are great. And you got to plan that. You got to get out and walk every day. That's not something that's just going to happen if you don't begin to have a plan for your day. And again, that can actually help with your weight and help with not coming home and having all the treats that we always like to have. And then we talked a little bit about a balanced diet. Um, that's important. Balanced diet is something that, depends on your lifestyle. If you're working hard, you're grabbing produce, food uh, on the way home. I think you again have to plan your week. If you can buy your own food and cook your own food, you're much better, better nutrition. Um, and actually preparing food is something that I think everybody enjoys to get in the kitchen and put it together. So cooking your own food and, get some recipes. I'm sure there's fertility recipes out there on Google, but you want to have a balanced diet of protein and fat and, um, again, to help to manage your weight. And everybody asks about supplements, and certainly there's some data to say that prenatal vitamins are important. I think what you eat is probably more important than the vitamins, but supplements that in prenatal vitamins, they have supplement in terms of iron. You want to have a good blood count. You want to be anemic going into pregnancy. Obviously, you need to work with your primary doctor if any chronic medical conditions, high blood pressure or diabetes. Certainly with high blood pressure, you want to get that managed. A lot of times with weight loss and diabetes, the adult onset, loss of 10, 15, 20 pounds, the blood pressure problems go away. It's same thing for the diabetes. But again, that comes back to working with your primary doctor. If they think you're a candidate for one of those other weight reduction medications today. And I think we're safe. There was some data that says, well, you ought to stop those medications 3 months before you get pregnant. And now a lot of people say, well, 1 month is probably okay. I don't know if there's any long-term data that says that any of those products affect your eggs. We're still looking at that. I think getting your body to a best place it could be physically with your weight and exercise has tremendous advantages. And then we were talking too about avoid situations that raise scrotal temperature. They talk about hot tubs, and you got to be in a hot tub, every day for a long time to probably have any effect on that. Unfortunately, we're all sitting in our chair on our computer a good part of our workday. And that may affect some issues in terms of what they call spermatogenesis or the genesis of sperm. So avoiding high temperature, I think, is a worthwhile thing. There's been the argument back and forth about boxers and briefs. I don't know if that applies to all men, but if you're sitting down through most of the day with your computer at work, getting up to walk around is probably a worthwhile thing, and not wearing real tight-fitting jeans, which I know that's kind of the style today. But those are kind of simple things that may help some. So we'll go to the next slide. So things to avoid, extreme diets. We don't know a lot about very quick weight loss with extreme diets. I think that's not good physiologically. And again, that's getting the plan of exercise and preparing your own meals is the best way to avoid, extreme loss of calories. Cryotherapy is, we don't know much about that. It may have some benefit. And then we talked about boxers versus briefs, and I think trying to get up and walk around regularly during the day, if you have a sit-down job, is a good thing to do. And then there's a lot of talk online about supplementations and a lot of people that are taking high dose vitamins. And again, we don't have a lot of good data on that. I think everything in moderation is probably good. I tell people, have treats, get a good night's sleep. plan your meals, and you can have treats, desserts that aren't excessive in terms of calories. Uh, I think once you start being too strict about your diet, it really creates another level of stress that nobody needs. I think you need and exercise sensibly, and that's probably the very best information that we can give you. Next slide. So female supplements, we talked about prenatal vitamins that have a folate and B12. I think that's really important. I think there's good science to that. CoQ10 is a supplement that is kind of like an anti-inflammatory. And again, there's some data suggest that it may have higher quality embryos. Easy thing to do, doesn't have side effects. And then again, vitamin D, we always check that initially, make sure your levels are in a good range. There's been some thought recently that the range of normal for vitamin D was way too high. But again, vitamin D is in the supplements and it's always checked. And if your vitamin D is on the lower side, particularly if it's in the teens, then I think you need supplementation to bring that up to a normal level. And things to avoid, alcohol, cannabis, and tobacco. The other thing that I want to put in here is over-exercising. I was talking to a patient maybe a month or so ago. We were talking about exercise, and said pulse of 130 is a reasonable exercise level pre and pregnancy. And she says, "Well, I got a bike, and my pulse rate's 160." And I think, that's really excessive exercise. I think people think they should have a very high pulse rate and for a long period of time. I think 130 is very reasonable for 40 minutes. And there's talk today about exercise every other day is probably better than trying to burn the calories every day. I think we'll probably hear more about that in the future, but so alcohol, and people say, well, having 4 drinks a week during IVF had a lower pregnancy rate. I think alcohol, creates a lot of chemical imbalance, dehydration and so on. I think if you want to have a glass of wine on the weekend, that's fine. But I think other than that, you probably ought to try to avoid alcohol. And the same thing for men. Cannabis, I think we don't know about cannabis in terms of genetics and embryo quality. I think it's best to avoid chemicals in your body that we don't know about. And I think we know a lot about tobacco. The nicotine creates vasoconstriction, may reduce blood flow to the ovaries pre-pregnancy and during pregnancy. So I think stopping smoking, I think everybody would suggest that. So there are some male supplements. And again, there's when you do male testing, they look at the sperm count. You want to have about 15 or 20 million sperm, and that's important. Motility is probably the most important factor. You can have 15 million sperm, and if those sperm swim really well, you probably have very normal fertility. Proxene is a product that has anti-inflammatory and carnitine, and if the sperm count's a little bit low or the motility is a little bit low, it's been shown to be helpful in some studies. Again, I think for men, moderate exercise, good nutrition, and stress reduction are 3 things that we know improve everyone's physiology. Again, CoQ10 is 200 to 600 milligrams a day, can improve sperm concentration and maybe motility. There's a lot of concern about the morphology or the shape of the sperm. And you look at sperm count results and they say that, there's only 15% of the sperm have normal shape. And that's what you commonly see. But if you got a good count and good motility, if you have a lower morphology rate, it does not seem to affect fertility. So morphology is something that used to be a factor where they'd put everybody on cocaine or CoQ10 or Proxy. But motility is probably the most important thing, and you multiply that by the sperm count, and then you get the total motile count, and that is the indicator that you have a very normal sperm function. Unfortunately, we don't have a test that tells how well sperm works. Obviously, when you do IVF and you put the sperm and egg together, you look at fertilization and how embryos grow. But looking at sperm count, unfortunately, there's some men that may not have really good functioning sperm that isn't shown up on the standard semen analysis. There's another test that looks at DNA fragmentation of sperm, but it's a little bit controversial in terms of what that really means. But those are two tests that we do have for men. And again, vitamin D supplementation may be helpful in better quality sperm. But a lot of men, multivitamin is a good thing to do. Go to the next slide. And we talked about alcohol and keeping that to at the most 1 to 2 hard drinks on the weekend. And I try to avoid that, going to parties and, of course, football season's almost over, but, there's a lot of alcohol get consumed in sports venues. So I think you need to try to avoid that as much as you can. And we talked about cannabis. I think that's something that we don't know about and you ought to just avoid. There are some men that work in groups and cannabis is kind of a part of that culture. People that write or entertainment industry, I get it, but I think at the same time, you want to try to avoid that in terms of your general health. And again, we talked about tobacco, nicotine causes vasoconstriction and may interfere with the normal blood flow to the testicle where sperm development takes place. And the final is, anabolic steroids. And you see men coming in with this 0 sperm count that their, family doctor says, well, your testosterone is a little bit low. Let's give you some. Well, and they feel better, but they don't have any sperm. Exogenous testosterone suppresses sperm count dramatically. So that's something, if you're taking any kind of anabolic steroids, that's something to definitely want to stop. And it takes probably 2 to 3 months, and that is sperm generation time, 72 days to recover from that. So we look at treatment options and this has really changed dramatically in the last few years. Freezing eggs. We know many women going through school and careers, and you don't think about really having a family till 35 and above. Well, we know that the genetics of the egg begin to decrease starting at 35, not for all women, but for some. And by 40, there's a dramatic decrease. So freezing sperm allows, or freezing sperm and egg allow for starting a family in the late 30s, early 40s. Embryo freezing, where if you have a partner and you're not going to be able to get pregnant because of work or careers or other kinds of things, making embryos, and you can genetically test embryos. And once you get a genetically balanced embryo, the pregnancy rate can be 65 to 70% with each embryo. We know that women or couples that have undergone 3 embryo transfers, the full-term pregnancy rate is close to mid 90%. So again, by freezing embryos, you get an idea of how many embryos you have and their potential, but what are your plans for your family? Some people say, well, 1 or 2. By the time people say, well, I came from a family of 3 or 4 siblings, and I'd like to have that possibility. So embryo freezing gives you the best option in terms of knowing the probability of success with transferring embryos in the future. IUI is intrauterine insemination. Again, couples that are attempting pregnancy and been struggling for a while. It's one of the first kind of low-tech treatments. At ovulation time, the woman comes in and partner gives a sperm specimen, and they do what they call a swim up or a sperm wash to pick out the 20% of sperm that are the good swimmers. And those are the ones that can fertilize an egg. So it takes about an hour to do that preparation, and they reduce it down to just a few drops, which is then put in the uterine cavity. It's like a pap test, and there's no recovery from that at all. You go about your regular activity. So that's something that's been shown over the years to improve pregnancy rates for even men that have good sperm counts. So that's a beginning treatment for women who are ovulating, and the semen analysis normal, and the other testing is normal. Fertility medications sometimes are added to IUI to increase the number of eggs, particularly for women in the late 30s or 40s. If you can release more than 2 or 3 eggs, the better chance of fertilizing an extra egg or two, and again, getting an embryo that's genetically balanced. And essentially, that's what you're doing for IVF is to get 15 or 20 eggs, ideally for women in their 30s. And generally, that gives you somewhere between 2 and 4 genetically balanced embryos. And each of those embryos then has about a 65, maybe 70% pregnancy rate. So again, doing IVF and genetically testing embryos gives you the very best probability of success in the future. And so people ask about surrogacy. They say, well, gee, if I transfer it into a surrogate uterus, and that's a woman that's probably in her 20s and has had 1 or 2 normal pregnancies, will that increase my chances? Maybe a little bit in some situations, but uterine receptivity is generally very good for women. We transfer embryos to women up in their late 40s. And I think the data for that is pretty solid. That the uterus retains its receptivity to the late 40s, maybe even early 50s, because the lining of the uterus is brand new every month. So surrogacy has greatest potential for women that have medical issues that they just cannot carry a pregnancy safely. And then finally, we have donor eggs or donor sperm. Typically, couples or women that select donor eggs or have diminished their egg reserve to the point where they know that IVF is not going to be successful, or like maybe less than 2% success. And again, egg donors are young women in their 20s, and again, usually 25 eggs with somewhere between 4 and maybe 6 genetically balanced embryos. So that will allow a woman or a couple to have several full-term pregnancies. If the male partner does not have sperm, or a woman is single and gets sperm from a sperm bank, that has the opportunity for fertilizing eggs. And sperm donors are 25-year-olds, so that it's really very high quality of sperm structurally and genetically. So today, with even for women who have a very diminished reserve or having genetic issues with the age effect, using donor eggs, or men with a very low sperm count still can become pregnant and build a family. This is a slide showing about intrauterine inseminations, and we look on ultrasound to see where ovulation is, and sometimes we trigger the ovulation with an injection, so the egg is released the next day. And then we put that little drop of processed sperm in the uterus. Again, it's as easy as a pap test. Next slide. The other process is egg retrieval, and that's the same for freezing eggs or for IVF, where you're going to make embryos. You have to have a mature egg, and women ovulate day 12, 13, 14 of their cycle, so it takes about that many days to mature an egg. And maturity is important because a mature egg, you can't fertilize an immature egg, and you can't freeze an immature egg. So whether the woman is doing freezing of her eggs to preserve the fertility, or for infertility, making embryos, it takes about 12 days of injection of follicle stimulating hormone. And there's only one thing that makes follicles grow and mature is this hormone, which obviously women in a natural cycle maybe start with 8 or 10 or 15 or 20 eggs, but one egg is, one follicle becomes the dominant follicle, and only that one egg is mature and released, because humans don't have litters. I mean, twins are 2%, but we do IVF or egg freeze. We're using injections of follicle stimulator to bring to maturity would be wasted eggs. So there's no early menopause. Natural injectable FSH has been used for 40 years. Again, there's no long-term side effects for that. And again, ovarian hyperstimulation or overstimulating the ovary is very uncommon today with newer techniques. So it's safe, but it takes about 12 days. And again, you have to inject every day. You learn a new skill. It's like insulin under the skin. And some women say, I feel great. There's always that 10 or 15% that kind of struggle with bloating or sometimes some mood changes, but 80% really do quite well with injectable follicle stimulator. So this is just a little diagram of, at the top, you can see that they call it chocolate chip cookies. Each of those little dark circles are about 5 millimeters. There's an immature microscopic egg on the wall of each follicle. And over stimulation for 10 to 14 days, the follicles are now quadrupled in size. And now there's a mature egg in most of those large follicles. And then you can see the retrieval, the needle going into the ovary at the 11 o'clock position. And you aspirate the fluid. It's just a teaspoonful, and it goes right into the laboratory. And the embryologist then takes the egg from the fluid, and then will freeze the egg if it's mature, or fertilize the egg if they're doing IVF. It's about a 15, 20-minute procedure for many. It's a very light anesthesia called propofol. And as soon as they're done with the retrieval, you wake right up from the propofol. There's not a lot of nausea. Most people are able to leave within an hour, hour and a half, go back to the regular activity the next day. So it's, and then again, a lot of the bloating is side effects from very high estrogen levels with the stimulation of all those follicles subsides pretty quickly over a few days after the retrieval. So it's safe. Complications of bleeding or infection are very rare today. So here's kind of shows what a fertilized egg looks like, and then it's divided to 2, 4, 8 cells. And you can see the diagram on the right where they're taking a few cells from the embryo to send off for genetic testing. And it doesn't damage the embryo. It's probably 100 cells, and you're taking 2 or 3, and then you freeze the embryos. And you can see this blastocyst at the bottom is about 100 cells. When you freeze that embryo, it will thaw and look just like that, probably 98% of the time. So the freeze and the thaw does not damage the embryo in any way, but it gives you the opportunity to genetically test the embryo, because that takes about 2 weeks. So once the embryo is frozen, you get the genetic report back in a couple of weeks. And then the following week is when the embryo is transferred, or the following month, it's about 6 weeks later. And again, you look at success rates with genetically balanced embryos is 65 to 75%. The other benefit is that the miscarriage rates drop tremendously. Miscarriage rates for any pregnancy is 15, 20% as you get into late 30s. When you transfer a genetically balanced embryo, miscarriage rates are about 8, maybe 10% at the most. So you are able to reduce the rate, because when you genetically test embryos, we know that embryos that have extra chromosomes tend to miscarry at a very high rate. So you don't transfer those embryos. Next slide. So this is a little embryoscope. They're looking at how an embryo divides 2, 4, 8 cells. And it's kind of like magic over about 5 days to get it to the blastocyst stage of about 100 cells. You'll see that right here at the end, how it spreads out. And then you can take a few cells for genetic testing, and the little ball of cells up at the top, at 12 o'clock is the actual embryo. And we don't want to take cells from the embryo. You want to take it from the placental tissue. But this is amazing technology. Let's say we're one of the few programs that have an embryoscope to look again at how symmetrically these embryos develop. And then you can rank embryos. The embryos that develop symmetrically, 2, 4, 8, are have greater potential than those that go to 1 to 3 or 2 to 5 cells. Next slide. All right, we'll kind of open it up for questions. I know everybody has questions. And there aren't any bad questions. All questions are good.
So here is the first question, Dr. Danzer. How many months before egg freezing should one stop birth control? Does it make any difference to egg freezing if someone was on birth control for many years? And also, how many months before egg freezing should one quit drinking any alcohol?
But maybe you could do that, Susan.
Okay. So I tell patients that they should stop birth control, meaning birth control pills, for at least 1 month before egg freezing. Sometimes 2 months is necessary in order to get the ovaries to wake up and be responsive to stimulation. Now, patients who have an IUD, intrauterine device, form of birth control, a lot of times we can leave those in place during the stimulation, as long as the patient's ovarian reserve is otherwise normal. Now, in terms of quitting drinking alcohol for egg freezing, I tell patients they don't have to quit, but you don't want to drink a lot. So if you're going out and you want to have a glass of wine, that is fine, but you do not want to have excessive alcohol consumption because that can negatively affect your egg quality. So this next question is, what is the controversy that you mentioned, Dr. Danzer, regarding DNA fragmentation? This
Yeah, there's been a
patient.
lot of, well, not a lot of work, unfortunately.
Mhm.
So much of the work in andrology, that's male fertility. There aren't really good studies that are well powered, that have enough individuals to give you good results. And there'd been some question about with DNA fragmentation, how much does it impact a given individual? I think it has to be taken in context with other things. If you have a normal count motility and your morphology is a little bit low, I don't know that DNA fragmentation has a big impact on the ability for to produce a high quality embryo. And I think that's some of the most recent work when they look at embryo quality, blastocyst. If you have a very low sperm count and high fragmentation, that's a different matter. And you see that sometimes where they require actually taking sperm, aspirating sperm from the testicle, fresher sperm in that way or early in their development certainly has shown benefits for men. So the DNA fragmentation, I think for normal semen analysis, we don't know a lot about. I think for men with very low sperm counts, it does have some effect.
And Dr. Danzer, do you recommend Zymot for patients with elevated DNA fragmentation for IVF?
I think that's helpful. Zymot is that new technology to select out the best shaped sperm. I think there's data to suggest that Zymot does help improve pregnancy rates when you have a low sperm count. It can't be too low because you have to have at least 15 to 20 million sperm to be eligible for this Zymot. But the theory is that you're selecting out the best swimming sperm and the better shaped sperm, and that may improve blast formation and pregnancy rates.
So the next question says, how far in advance should somebody start supplements such as prenatal vitamins, if they're trying to get pregnant? I usually tell people to start 3 months before they're trying to conceive, just to make sure they have adequate folic acid levels. Um, if you're starting a fertility treatment and you haven't been on a prenatal vitamin, it's okay to start it, when you start your IVF cycle, at that time. Mhm. Let's see, the next question says, I'm thinking about IVF and a functional doctor told me to do a Dutch test. I have PCOS, and trying to find out if you have hormone imbalance. I'm actually not familiar with a Dutch test. Are you, Dr. Danzer?
Don't think so. It must come
Yeah.
under, there must be some other name to it also.
Mhm.
Certainly with PCO, it's sometimes difficult to get pregnant. A lot of PCO patients get pregnant fairly quickly with fertility medication. Um, There are some women that go to IVF with PCO that don't have the number of embryos you would expect for the given age. So there are things about PCO we still don't understand. Um, But I think the standard protocols in terms of induction of ovulation with Clomid or letrozole and IVF are very successful for women with PCO.
Um, So the next question says, I am 34 years old. My AMH level is 0.17, and my doctor said I should not do IVF. So, I think when we evaluate patients with a low AMH, we have to look at the whole patient and each person individually. I always ask, why is the AMH low? Is it low because you've been suppressed on birth control pills, or is it due to excessive exercise, or what is causing that low AMH, or is it truly a function of having low ovarian reserve? And then I also look at the patient's age. In terms of, so a 34-year-old may have a low egg reserve, but their egg quality may be adequate versus somebody who's 40 who has a low AMH. And so it's, and sometimes the AMH does not correlate with follicle counts on the ovaries or FSH levels. And so we have to do sort of a full workup before deciding if a patient is a good candidate for IVF or not. Mhm.
Yeah, I agree. I think follicle count is more accurate than AMHs. And you'll see women that sometimes have repeat AMHs and it's perfectly normal. So
Mhm.
you don't rely on a blood test, especially an AMH, to uh, be concerned about your fertility. I think as Dr. Maxwell indicates, you want to look at FSH and follicle count to get a plan how to go forward.
Yeah. The next question is, why is birth control prescribed prior to IVF? Um, so, there are many different regimens to prepare women for stimulation for IVF. Sometimes we start cycles when somebody gets their period on day 2 or 3. Other times we start a birth control pill beforehand. The advantages of the pill is it can sometimes help with synchronizing the cohort of eggs to make sure they're growing together. Birth control also helps with timing and scheduling for patients if they want to know when they're going to start and when their procedure can be for work purposes. So, there are different regimens, and birth control is often used beforehand. Do polyps in the uterus affect fertility?
I mean, answer that. Well, they can. Yeah, certainly, the
Uh-huh.
endometrial cavity is about kind of the size of the tip of the little finger, and a polyp that's a centimeter. Um, may occupy most of that cavity. And the theory is that an embryo, if it implants on a polyp, it doesn't have a good blood supply. It can't support the pregnancy. So I think when we see polyps, it's generally recommended you remove the polyps if you're anticipating pregnancy.
Next question is, can you talk a little more about 3-day embryos at 5 to 7 cells? What does it mean that they don't have even number of cells or a multiplication of 2? So I think they're talking about cleavage stage embryos and how it's typical for a cleavage stage embryo to have 8 cells, to have even cell division. But some don't. Some have, somewhere between 5 and 8 cells. Does this mean anything? I don't know, what do you think about that, Dr. Danzer? When you see
Well, there's a lot of there's
Mm-hmm.
other issues with day 3 embryos, which we used to do with IVF before we had genetic testing.
Mhm.
And again, there's a lot of day 3 embryos that blossom and look like beautiful blastocysts at 100 cells in 2 more days. So it's a little hard to predict um, the genetic or the structural quality of a day 3 embryo. The guidelines today is that we, with the genetically tested embryo, which is day 5, the pregnancy rate is 65 to 70%, and we transfer 1 embryo. You don't want to have twins. But if you have a day 3 embryo that hasn't had the time to get to day 5, which is the first test of the genetics, half the embryos don't make it from day 3 to day 5. So the guidelines for the Fertility Society says you can transfer 2 or maybe 3 day 3 embryos. But whether it's abnormal, whether it's even or uneven, I don't think that has a lot of impact on the potential. I think the woman's age at the time is probably the most important.
The next question is, what dosage for vitamin D is recommended? And is 1 a day prenatal for men as good as Proxseed? So I think the recommended daily dose of vitamin D for men or women is 1,000 units a day. That's a standard dose. 1 a day vitamin for men should contain around that level of vitamin D per day. Proxseed, I believe, has different supplements in it, like CoQ10, not just vitamins. So
L-carnitine, which has been
L-carnitine.
associated with maybe better a better shape of the sperm. Like I
Mhm.
say, the data for that is kind of soft. I wish
Mhm.
we had better data on these supplements and how much they help in terms of a live birth. And that's the kind of studies that you want to have to say a product or anything changes it. It's what's the live birth rate, and that those studies just aren't very available today. But I think Proxseed is a good product, and I don't think there's any downside to it. I have a lot of men who prescribe that for it.
Yeah. I usually recommend men take a multivitamin and then CoQ10, 200 milligrams twice a day. Mhm. The next question is, would you recommend DHEA or testosterone supplements? So I generally don't recommend testosterone supplements. DHEA supplements can be given to women who have lower egg counts or lower reserve. And the idea is that it's a weak androgen and it may help have more antral follicles be present on the ovaries. But I don't know how strong the data is for that either. Mhm. Next question is, would you recommend doing 2 to 3 cycles of egg freezing directly, one after the other, or is it best to give the body a break? Mhm. I think patients do great cycling back to back. I think sometimes doing a cycle, cycles in succession, they get better with the second cycle. It's certainly not harmful to cycle back to back. It just really depends on how you feel and how you tolerated the first cycle. And if you feel like your body needs a break from the medications and stimulation, then it's okay to take, a few months in between as well. Mhm.
And basal follicle counts generally aren't going to change within 3 to 6 or even in young women in 12 months. So that kind of rushes, you're going to lose all your eggs in the next 3 months. I think you can relax about that.
Yeah. Um, let's see, how much omega-3 to take daily? I don't have a recommendation for dosing for omega-3s. I just recommend, eating foods that are rich in omega-3s. Are there long-term side effects from the injection medications? No, I mean, the injections that we're giving to stimulate the ovaries are short acting, they stimulate follicle growth. I don't know any long-term side effects of the injection medications. As the follicles grow, the estrogen levels do increase during that period of time.
I think the studies are pretty clear. There's no increase in breast cancer.
Mhm.
There's a few studies that show that maybe there's some slight increase in ovarian cancer that's early stage. But it's very, very mild increase if the studies are mixed on that.
Um, see, the daily prescription of supplements for female. So again, the daily supplement I recommend for women trying to get pregnant is a prenatal vitamin that contains at least 800 micrograms of folic acid and has at least 1,000 units a day of vitamin D. And then if you want to additionally take CoQ10, which is a potent antioxidant, you can take that at 200 milligrams twice a day.
I think we're running over a little bit. Maybe this
Oh,
has to be the last question.
Okay. Let's see, how long can eggs be frozen for?
10 years plus. I think we're probably out to about 8 years in our freezing group here at SCRC. And right now the thaw rate is 80%. I think we have not seen any dramatic decrease, and I think we're out to at least 8 years in our program here. So it's probably 10 or more.
Okay, great. So this concludes our webinar. Thank you so much for joining us. If you have, personal questions, you want to schedule a consult with any of the physicians in our group, we'd be happy to evaluate you and assess, your needs. Okay, thank you. Have a good night.
Thanks for attending. We were happy to have you.